So this kind of reminds me of some of the vigorous intermittent lifestyle physical activity studies, VILPA, as you have called it, that you've been a part of.
VILPA is Vigorous Intermittent Lifestyle Physical Activity, and very much led by my colleague, Professor Emmanuel Stamatakis out of the University of Sydney. So to be clear, we're talking not structured exercise. And so we're talking activities of daily living that you would be doing anyway. But leaving my hotel room, I had a choice of taking the stairs or taking the elevator. And so the question there with VILPA is, in these activities of daily living that are already part of our lives, if you embed vigorous effort in those, another classic example would be you take a 5-hour flight, you get off the plane, you have the choice. And the question that's being asked in that research is, if people choose to do that in a vigorous manner, is that meaningful? And there's some evidence for that, including a large study that was published in December that was, it mined the UK Biobank data. And so what that allowed the investigators to do was look at over 25,000 individuals who engaged in VILPA-like efforts. They wore accelerometers to try and capture this, and they were followed over almost 7 years. And the outcomes included all-cause mortality, cardiovascular disease mortality, cancer mortality. And that work showed or revealed that people who engaged in even 3 to 4 minutes total a day of VILPA-like activity had substantial reductions in all-cause mortality risks. We're talking 25, 30%. So that would suggest that even brief, non-exercise, vigorous, intermittent physical activity can move the needle in terms of health outcomes. If I can add, the other key thing from that study, I think, is that all of these people were self-identified non-exercisers. Building in VILPA-like activities in a smartwatch or an app on a phone and encouraging you to accumulate 3 or 4 or 5 or 10 minutes of VILPA a day. But 3 or 4 minutes of VILPA is, about 30 minutes of vigorous activity a week, and large reductions in risk.
Yeah, and that is very doable.